I were your doctor and you had anxiety symptoms, your chest feels tight, your heart's racing, you can't focus, you wonder, am I dying or is this just anxiety? You're not alone. Anxiety is one of the most common symptoms that patients tend to bring up to me. If you came into my office today with anxiety symptoms, here's how I'd listen, what I'd look for, and yes, what I think of those viral supplement hacks that promise to calm you instantly. If you were my patient, the first thing I'd do is pause. I'd listen because anxiety is very real. It's not just in your head. Then I'd ask some questions. When do these symptoms show up? How often do they show up? Do you notice any patterns or triggers? Maybe lack of caffeine or too much caffeine, lack of sleep, stress around certain people. Most importantly, how is it interfering with your life or affecting the quality of your life? Sometimes what feels like anxiety is just a medical issue we need to rule out, such as thyroid problem, heart rhythm changes, or even certain medications. So before we jump to just plain old anxiety, we want to make sure we're not missing anything. So what helps anxiety symptoms? If your labs and history look okay, we focus on tools that can actually help. Breathing resets everything. Slow inhale, longer exhale can lower the heart rate. Movement, of course, exercise burns off the stress hormones. Cutting caffeine, especially after 2 p.m. Sleep rituals, you want to have a consistent bedtime, no phone in the bed. Therapy and support. Anxiety isn't weakness, it's human. And support matters. We all need each other. We all need to rely on each other. Now, of course, there's a lot of trends going on TikTok. Let's react to some of these viral anxiety supplement hacks that we've seen. Here's the truth. Some supplements like magnesium or ashwagandha can help a little, but they're not magic. The danger is when people replace real care with quick fixes. Supplements may support your body, but anxiety needs a bigger toolkit. So I'm not saying no to supplements, but you should supplement the supplements with other tools to help combat anxiety in different ways. Now, of course, most people do have some level of anxiety, but when is anxiety serious? When the symptoms mean it's time to reach out quickly if you notice any chest pain, because it could be heart related. Sometimes panic attacks are so severe that they stop your daily life. I really hope that this doesn't happen to you. Thoughts of harming yourself or harming others, those aren't things that you kind of ignore or just push through. That's when immediate support truly matters. And the good thing is there is a lot of support, especially where we are. So in closing, anxiety doesn't make you weak, it makes you human. And while supplements, breathing, and lifestyle tools can help, the real power comes from knowing you're not alone. And that help does exist. So look, I suffer from anxiety too. I'm just as human as you are. And I have my moments, I can freak out. I try my best really to stay grounded and try to observe my thoughts, but I can't do it alone. Music, of course, has always been something for me that helps me kind of calm down or at least get me out of that rut, especially when I'm stuck on the same thoughts over and over and over. That can drive you crazy. I'm not a big fan of wearables, but obviously nowadays they have a bunch of wearables like the Apple Watch, Whoop, that can measure your heart rate, your temperature, and your pulse, and just kind of see. A lot of these sometimes can measure if you are stressed or not, just based on your heart rate and the heart rate variability. So for those who may not think they're stressed, but then are stressed, they may be able to use these monitors to actually tell, like, oh, actually, my heart rate did go up while I was feeling this episode. For me personally, anxiety, to help it, plain old pen and paper. That's it. I don't need a TV, I don't need the phone, I don't need to do anything. Just sit down with your thoughts, if you're up for it. The hardest thing to do is look inside. A lot of our anxiety stems from ignoring things that our body's trying to tell us, ignoring our gut, sometimes dissociating with who we really are, and wearing all those masks in different settings. We have to wear masks as a social construct of our lives. You might wear a mask. You might be one person when you see me in the office, You might be a different person when you go home and meet your wife or husband. You might be a different person when you're at work. You might be a different person when you're with your friends. But are those different people congruent, or are they all different masks that you wear? Because at some point, you wear that mask long enough, you will become that mask. And you may not know who you are when you look in the mirror. For me, anxiety is not a problem, it's a process. Usually lifelong, right? Life is such nowadays that we are the most productive humans and individuals ever, probably in the history of life itself, or a history of humanity. Yeah, why are we so stressed? Is it this? Is this all this Instagram and TikTok that we're doing that's making you stressed? Is it all that doom scrolling? Is it because there's so many deadlines and everything so nicely put into a calendar, and then you got to put it on your iPhone and share my calendar with my wife, my kids, got to share it with my friends, I got to pencil you in just to talk to you? Are we a slave to our calendars and time itself? Or can you just let it go and let time be? So for me, anxiety is very real. And a lot of my patients, I always ask them, are you stressed? Are you anxious? And what do they say? Yeah, I'm stressed, but that's normal. Everybody's stressed. Yeah, it's normal. Yeah, everybody I know is stressed. Yeah, everybody I know is anxious. Yeah, I'm used to it. When have we come to a time in society where anxiety and being stressed is a normal way of living? I can't think of another time when that was a normal or even a healthy way of living and being. And the truth is, do you yourself want to live like that? I hope not. I don't want to live like that. My mind races a lot. I can have a lot of racing thoughts, but I try my best to get it out of me. A lot of people just bury it. And I promise you, your body's very smart. If you bury your anxiety in your body will react and it will find its way out. So I tell patients, you got two options. You continue to bury your anxiety and ignore it and just live life full throttle and hope everything's okay. And hopefully the anxiety dissipates some way or somehow, and hopefully it doesn't come back out. Or you do your part and actively guard against it and work with it. I don't think anxiety is a problem. I don't think anxiety is an enemy. Anxiety is sometimes part of your shadow that we don't always come in contact with. The shadow aspect of our personality that we tend to hide, that we ignore, that's what anxiety is trying to tell us. I think anxiety serves more as a tool, almost like a person that's kind of yelling and screaming for your attention, saying, hey, look at me, help me. There's something wrong here. You need to help me fix this. And hopefully we can fix it together. Carl Jung was a very famous psychiatrist, and he believed in the shadow. That's the part of us that we tend to ignore, tend to bury, only for it to come out later through repressed emotions, through anger, through disconnection with others. For me, I label anxiety as a person. It's a name. It's something I can talk to. Anxiety is not a thing for me. Anxiety is not it. It's a person. It's got its own character. And rather than ignore it and not listen to it, I welcome it to the table to sit down with me so I can talk and understand, why do I have my anxiety and where is it coming from? But most importantly, how can I work together with my anxiety to better ourselves? Because the truth is, anxiety is gonna come and go. Life is life. Things happen. People happen. Events happen. Situations happen. That is life. But how you react, how you respond, how you observe your thoughts and your anxiety really determines the quality that you will have in your life. I genuinely hope that all of you out there that do either suffer from anxiety or have anxiety don't identify as anxiety. Anxiety is a part of you. It should not be you. Just like any medical illness, or if you've got cancer or medical illnesses are a part of you, but it should not define your identity. So next time you're anxious, take a break and really ask your anxiety, how can I help you today?